Health News tonight, reconstructive surgery for women who have breast cancer.
Not a lot of women who are candidates for it are made aware of breast reconstruction. Tonight, News 8 medical reporter Jocelyn Menta here to tell us about those options.
Sonia and Darren, right now there are probably women watching who've recently been told they have breast cancer. This is not an easy time for them, and they are trying to make the best decisions possible. But one survey says 7 out of 10 women eligible for breast reconstruction after cancer surgery are not even informed of their options.
Jessica Mayalowas had a bilateral mastectomy.
No, I'm ready.
Now she's ready for breast reconstruction. The 31-year-old says not having it was not an option.
Some people, it's not a big deal to them, and more power to them. That's fantastic for them, whatever makes you feel good. For me personally, I had to have it.
Jessica chose to have the latest silicone implants approved by the FDA earlier this year.
It's more semi-solid inside. It retains its shape better.
Plastic and reconstructive surgeon Dr. Vin Pathy
It doesn't leak anywhere because it's a semi-solid.
is Jessica's doctor.
We can reconstruct breasts after mastectomies using your own tissues. You can also use it using implants.
Another option, using other body tissues.
So this is an example of the tram flap, in which we take the lower abdominal tissue, the tissue that we would actually throw out in a tummy tuck operation, and we use that to reconstruct a breast.
Dr. Pathy says most breast cancer patients are good candidates.
While some people might not be a good candidate for one type of surgery, they might very well be an excellent candidate for a different type of surgery.
Elizabeth Gilman had implants. Marquita Drayton chose the tissue-based surgery.
I wanted to feel like a woman the way I was before, and I was not going to let cancer control me.
Wow, I decided to have reconstructive surgery because it was my second time dealing with breast cancer, and I felt it was my only outlet to basically get even with the disease.
Choosing the right doctor is key.
The choice is yours to make. In the event that you do choose your surgeon wisely, listen to all of your options, take the time to do what's right for you.
Even if you're thinking that there's nothing there, there are so many options out there. There's different levels, and you really have to find the right surgeon that's going to speak to you and tell you what's out there, and you need to ask the questions. Don't be afraid to ask the questions.
Elizabeth and Marquita did not have complications after breast reconstructive surgery. Both say do the homework to minimize from that happening. Consult other doctors if needed. For more information, log on to WTeenage.com and we'll link you to several sites.